East Bank Station.
Terrion Sherman's life is seemingly one wrong track after another. A hell-on-wheels existence filled with violence and run-ins with police.
So y'all take people to jail for getting into fights?
At the end of the line, a young woman who loved him, beaten, repeatedly stabbed.
I mean, Abigail was like brutally murdered.
Next to Abigail's body, Sherman's 2-year-old nephew, covered in blood but alive. According to police records, Sherman said the boy became possessed like a dog, told him Abigail was really a man and a dog, so he punched her hard as hell, but didn't remember stabbing her.
How do you explain this case?
You can't. It's a case that shouldn't have happened.
A Care 11 investigation finds it's one of many violent crimes allowed by a break in the system, as Minnesota let Sherman and others fall through a gap, failing to treat their mental illness, failing to protect the public from known threats.
You can't even imagine this nightmare. You just can't imagine it.
Michelle and Tom Simpson
Hard for me to talk about.
are talking about their daughter Abigail's murder because they believe the responsibility lies not just with the man accused of killing her, but also at the door of this state agency.
I don't think people understand. Well, we certainly didn't.
To understand, you need Terrion Sherman's history. In 2016, he provoked an argument with a stranger on the train, followed him off to rob him,
Take his phone! Take his phone!
and with a friend, kicked and stomped his head into the tracks. In a plea bargain, he was convicted of just theft. The next year, 2017, he met 19-year-old Abigail Simpson from Wisconsin, who moved to St. Paul to get treatment at Hazleton for substance use issues.
She met him when she was in early recovery.
After treatment, Abigail returned to Wisconsin, while Sherman's troubles worsened. August 2018.
Breaking into cars, and he's been starting brush fires.
He was the subject of an all-out manhunt in Maplewood.
Been running around through the woods and neighborhoods terrorizing people with a garden hoe.
Also accused in 2 other assaults, including punching female employees while stealing from this store. But he wasn't convicted. A court ruled he was incompetent to stand trial, mentally ill, chemically dependent, and in need of treatment, because he posed a substantial likelihood of physical harm to self or others. The court ordered Sherman civilly committed to the custody of the Commissioner of the State Department of Human Services, DHS, which runs the St. Peter's Security Hospital. Just 2 months after he was committed, DHS issued this bulletin announcing a major policy change. Citing a shortage of mental health beds, DHS unilaterally decided to provisionally discharge, that means release, patients it felt no longer needed inpatient care, even people with histories of violence who had not yet been restored to competency. They explained it in this PowerPoint. To treat more people, they had to discharge more people. Terrion was sent to Joyful Home Healthcare, a Fridley group home.
Are you aware of any problems related to the change in how DHS handled competency restoration?
I don't know that I can answer that.
Dr. Kylie Stevens is DHS's chief medical officer. She says restoring a person to competency to face criminal charges is not their job. Treating mental illness is. So when they believe someone no longer needs a hospital bed level of care, they're now provisionally discharged.
It's very easy with large systems in government to think you've solved one problem and to create a whole new set of problems. And I think that's what happened here.
Judge Catherine Messerick explains that DHS decision created a new gap in the system. When someone like Terrion, still mentally incompetent to go to trial, is provisionally discharged, judges' hands are tied. They legally can't put them back in jail indefinitely.
They don't have the authority to do anything else but let them go.
And as a result, we have horrific events like what happened to Abigail.
Brandon Vaughn is an attorney representing Abigail's family, who didn't know until after her death Terrion was on provisional discharge from the state security hospital.
That's why we believe that this was preventable.
In the last 3 years, there have been 665 provisional discharges. But DHS says they don't track how many of those people were still incompetent. Carol Levin has identified multiple murders, stabbings, and violent assaults committed since then by people released while still incompetent.
Do things happen sometimes when people are on provisional discharge? Certainly. I can't tie that to any change that we made in our process.
Here's what happened with Terrion. Provisionally discharged at the group home, he was free to come and go. Records show during 8 months, he missed his daily antipsychotic medication 76 times and was even arrested, spotted selling narcotics on a Metro Transit train. Despite clear warning signs, Terrion was not getting the treatment needed for a safe and stable life. Ramsey County, now responsible for his care, never tried to revoke his provisional discharge. Meanwhile, Abigail returned to the Twin Cities for school and work, and the two were dating.
She was in a relationship with him. She cared about him.
They were babysitting Terrion's nephew together the night he's now accused of killing her, while delusional, hallucinating she'd become a man. He was later diagnosed with drug-induced psychosis and is now back at St. Peter. To date, incompetent to be tried for Abigail's murder. Her family is begging Minnesota leaders to hear their story and close the gap.
Do it as if their child's life depended on it.
Alandis Augustin is a one-man crime wave. Police and court records reveal assaults on law enforcement, bank and store robberies, multiple unprovoked stabbings, hijacking a vehicle with a child inside, numerous acts of domestic violence, including this attack on a girlfriend, leaving her bloody and battered. He's also a man with mental illness who falls through a gap in a broken system.
It ain't fixing a thing. It's making it worse.
Ramsey County Public Defender Jim Fleming's office represents Augustin and others just like him. So-called gap cases, charged with crimes, incompetent to go to trial, civilly committed to treatment centers, but discharged while still incompetent, back onto the street in a legal limbo. A cycle that just repeats over and over and over.
Are these gap cases any secret to anyone?
No. No, everybody knows about them, and who are working in the system. The prosecutors know, the defense attorneys know, the judges know.
Talk to anyone working in the system, and they point to a major 2018 policy change by the State Department of Human Services. To free up treatment beds, DHS began provisionally discharging patients back into the community who are still incompetent to face the criminal charges hanging over their heads. Legally, they can't be sent back to jail indefinitely where there's no treatment. So, as Judge Catherine Messerick explains, they're often just let go.
There's not a lot you can do.
If a person is not able to go back to jail and they're not able to be maintained safely in the community, then we don't provisionally discharge them. It's as simple as that.
Dr. Kylie Stevens is DHS's chief medical officer. She defends her agency's decision, but has no data to back up the assertion it's being executed safely.
Do you track how many patients who have been provisionally discharged since this change go on to commit more crimes?
We have no way of tracking that information.
DHS doesn't track it. The courts don't track it. Neither does anyone else. State Senator Jim Abler has already begun holding hearings in response to Carol Levin's investigation.
Part of the problem is, since nobody tracks these individuals who are running around the community, because it's nobody's responsibility, no one knows what happens.
So, what happens? Carol Levin tried to do what no one else in the state is: track these cases. What we found flies in the face of DHS's claim that they only release people who are safe to be in the community. In St. Paul alone, we identified violent assaults, including a police officer dragged down the street by a speeding pickup while being punched, according to criminal charges, by Damone Ivory, who had been provisionally discharged just 2 weeks prior. We found a case where a stranger raped a woman outside in downtown at 4 in the afternoon. Then there's the murder of Abigail Simpson, killed by a provisionally discharged boyfriend, hallucinating she'd become a man. Attorney Brandon Vaughn represents Abigail's family.
But oftentimes, there isn't real monitoring for these individuals who are provisionally discharged. And that's what puts the public in danger.
Despite limited access to records, to date, KARE 11 has identified 58 provisional discharge gap cases where the person committed new crimes. Alandis Augustin is a poster child. March 16, 2020, charged in the same night with assaulting this woman, then stabbing his neighbor numerous times in the chest. Mentally ill, incompetent to stand trial, he was civilly committed, sent to DHS's Anoka Metro Regional Treatment Center. September 2020, provisionally discharged, still incompetent to go to trial for the stabbing. February 2021, he's charged with stabbing another man, again incompetent to go to trial, committed as mentally ill, sent back to Anoka. Then, in July, DHS once more provisionally discharged him into the community, still incompetent, where no one's tracking the consequences of that decision.
If we have, as society, have made a policy decision that we're going to do it this way, we need to know what the consequences of that are. And we need to do better.
Mentally ill, sexually dangerous, and missing on the streets. For months, KARE 11 has been reporting on breakdowns in Minnesota's mental health and criminal justice systems. Tonight, AJ Legault reports on the case of a man accused of multiple sex assaults who everyone in the system lost.
The man walking down the sidewalk, seemingly without a care, is Omar Issa. He was accused of raping a woman on this picnic table in Minneapolis last August, but found mentally ill, incompetent to go to trial. He was civilly committed, supposed to be under the care of the Minnesota Department of Human Services for treatment. But DHS provisionally discharged him this summer. He was sent to this Fridley group home, where he was then charged with violently sexually assaulting a worker. The very next day, an Anoka County judge released him and issued a no-contact order, saying he couldn't go back to the group home, where, in theory, he was still under civil commitment.
What does that do to Mr. Issa?
Well, it renders him basically homeless. He's got nowhere to go except shelters and staying on a bridge or whatever.
Mark Gray is Issa's long-term civil attorney for his mental health cases. Issa, now a homeless, mentally ill, repeat accused sex offender, hasn't been seen since. After numerous missed court dates, judges in both Anoka and Hennepin issued warrants for his arrest this week, calling him a public safety risk. While the courts and DHS don't know where he is, KARE 11 easily located him wandering the streets near a Minneapolis homeless shelter and walking in and out of the Carmel Mall, where he's well known.
That's not good for him, it's not good for society. It's like a ticking time bomb to some extent. We're just kind of waiting to see what happens.
Mr. Issa did not want to speak with KARE 11 when we approached him. So far, we've seen no evidence anyone in Minnesota's legal or mental health systems has been actively looking to find this man, whose mental health attorney suspects is off his medication since becoming homeless.
This is like a screen door on a submarine.
State Representative Tony Albright says it's time to start sealing the leaks in Minnesota's mental health and legal system. Leaks KARE's investigation exposed, leading to a flood of murders, rapes, and violence.
What's the risk of doing nothing?
The risk of doing nothing is that we end up with more cases like you've reported on, where families are going to be ripped apart.
The cases we've reported are known in Minnesota as GAP cases. People battling mental illness, charged with crimes, found incompetent to stand trial, then released back into the community without appropriate supervision or treatment. The outcomes?
I had to tell my kids that mommy's not coming home.
Sadly.
I mean, Abigail was like brutally murdered.
Often predictably.
Could have been prevented.
Tragic.
He had shot up a bus and killed someone.
Someone has to step up and say, this has got to stop. Let's put people in a room and figure this out.
The Scott County Republican says he has legislation drafted with the backing of the State County Attorneys Association he'll introduce in January. He says it better melds the mental health and the justice systems together, so mentally ill Minnesotans living in the shadows stop falling into gaps.
Has that time come?
I believe it has. It has to. We can't go along like this any longer.